Let's now talk about CPR. We use CPR when someone has collapsed and is not breathing because it can keep people alive until emergency services arrive. D is for danger. First, look around carefully to make sure the area is safe for yourself and others before approaching. R is for response. Shake them gently by the shoulder and ask them, "Are you all right?" If there is no response, you need to S. Shout for help, as any assistance will be helpful. A is for airway. Gently tilt the head back like this to open up the airway. B is for breathing. Listen and feel the signs of normal breathing. Do this for no more than 10 seconds. If there is no sign of breathing, or if they are breathing in an unusual, noisy way, we need to start CPR. First, make sure that an ambulance is on its way. If you have someone else with you, then ask them to make the call. C is for circulation. Start by placing the heel of one hand at the center of the person's chest and interlock your fingers. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second, and hard means that the chest needs to go down by about 5 centimeters. If you have been trained, you can give 2 rescue breaths every 30 compressions, as this helps provide some oxygen. However, if you have not been trained or are not comfortable, just keep going with hands-only continuous chest compressions. Don't stop until either a health professional takes over or the person is definitely breathing normally. Sometimes we can add another step, D. D is for defibrillation, which is about delivering a shock to restart the heartbeat. Some public areas and workplaces have an easy-to-use defibrillation on site, called an automatic external defibrillator or AED. If there is no AED available, keep going with CPR until the ambulance arrives. That's it. So, to recap, remember DRABC. That's D for danger, R for response, A for airway, B for breathing, C for circulation,